Hey, it's Dr. Gonzo, and today I'm going to talk to you about common tips that will allow you to prepare better for open heart surgery. Now, these are largely based on my experience with patients, but also on comments left by patients after they have open heart surgery. So the first one is, you should consider buying one of these 4 items, and the first one is a heating pad. And why? Well, patients, when they lie in bed for a prolonged period of time, develop soreness of their neck and their backs. And it's usually because they're afraid of moving because of the sternotomy. And so having a heating pad at least alleviates some of that tension and will actually make you sleep a little bit better at night because then all those muscles then relax. The second one, and it also has to do with sleeping, is a body pillow. Now, a common question that I get is, hey doctor, when is it that I can actually sleep on my side? Most of the time I tell them that I want them to wait a month after surgery until they can do that movement. And so until that time, I suggest that they get a body pillow and they wedge it behind them, between them and the bed. And that way they can actually prop themselves up and have the sensation at least that you're sleeping not constantly flat on your back, but a little bit on your side. The third item that I would recommend that you purchase is, if you are a female having an open heart surgery through a sternotomy, is a surgical bra. And a couple of female patients I recommended that you buy it maybe one size a little bit bigger because swelling does occur around the incision. The reason to have a surgical bra is that sometimes the breasts do put tension on the skin incision, making it uncomfortable, and having a surgical bra that maintains the wound integrity would be a really good thing. The third one, and this largely is for patients that are a little bit older, is consider purchasing ahead of time a walker. And why is that? Well, after open heart surgery, sometimes elderly patients have a little bit of a difficult time getting around, and particularly with balance. And so having a walker ahead of time that allows them to do the exercise for them to recover faster, as well as for them to rest through the exercise process and the cardio rehab process, would actually be a nice thing to have. So consider getting one of those things. The second thing, the second tip that I would give you is become part of one of these Facebook support groups. And there's a number of them out there. I participate and I'm part of 4 of them. One is living with mitral regurgitation. The second one is mitral regurgitation repair patients. The third one is Diane's Aortic Health. There's also one that's called Heart Valve Surgery support group, and all of them are really good. There are new people joining the group that are about to have open heart surgery. There are people who have already had open heart surgery, and it's a really good collaboration and discussion about things associated to open heart surgery, and I've learned a lot by participating in those programs. The third one, the third tip that I'm going to give you is that ask your physician to meet with a physical therapist or a nurse in the intensive care unit ahead of time so that you can practice and learn how to turn in bed to get out of bed. Now, this is what happens. You're in the intensive care unit, you're asked to lay still so that you don't put undue pressure on the sternum. And then you're asked to get out of bed independently, and they have these exercises and movements that they teach you in the intensive care unit so that you can get out of bed independently. Well, practice it ahead of time. Ask your doctor to see if you can meet a nurse or a physical therapist who will teach you how to get out of bed, and you can practice it at home. The fourth tip is ask your doctor to meet with a support service staff member. And these are individuals that are there in the hospital to help you get through the open heart surgery by comforting you and alleviating some of the anxiety. They're not only good for you, but they're also good for the family members. And they're also really good people to get to know, because after surgery, if you develop depression or if you develop a lot of anxiety associated to what's happened to you, you can always go to them and they're a really good source of support. The fifth tip is one that I typically suggest to patients, that is, what do I do with the anxiety, or how to manage the anxiety associated to the night before your procedure. And there's two ways that I suggest patients that we could deal with it. One is giving you a pill, an anxiolytic, so that at least you can sleep the night before. The second one is actually a much more common remedy, is that if you want to take a beer or a glass of wine or a small cocktail the night before surgery, then that's okay. It's not that you drink a whole case of beer or that you drink a whole bottle of wine or that you drink a whole bottle of gin. No, just take one to relax you, and oftentimes that's all that you need for you to fall asleep and then get ready for the next day. Now, the following tips are largely for what's going to happen after you have your open heart surgery. And I want to make sure that you remember this because it's really important for you to know this. When you come out of the operating room, some patients will come out with a breathing tube. Now, the breathing tube usually is taken out either in the intensive care unit the day of the surgery or the day after the surgery. Now, it is incredibly uncomfortable thing to have, and a lot of patients don't remember it, but those that do describe a bunch of senses of feelings of anxiety and not being able to breathe and uncomfortableness and coughing, which are completely normal. Here's what I would suggest that you do. First of all, find a family member that will be there with you during the process of getting the breathing tube out. Now, just know that we do everything in our power to make sure that you do not remember having that tube in. And there are a bunch of medicines that we give you during the process of what we call extubation or pulling the breathing tube out. During that process, having somebody there at the bedside that at least can alleviate some of the anxiety would be extremely helpful, and it is extremely helpful. So make sure that ahead of time you identify who that person is going to be, so that at least they can help you in terms of getting through that particular part of the procedure. The next tip has to do with taking your pain medicine. Now, surprisingly enough, most patients don't complain about the sternotomy. What they complain about is pain associated to the chest tubes and the leg where we took out a piece of vein to do bypass surgery. Those are the two most uncomfortable parts of the procedure. It's not the sternotomy, and I hear this over and over again. Now, the thing is that with the chest tubes, we try to remove them as fast as we can because A, we don't want people to be uncomfortable, and B, we don't want to increase the risk of infections. And so we try to take them out as fast as we can. Now, taking them out does not hurt. It feels weird or feels a little funny, but it does not hurt. But if you are uncomfortable because of an incision or a chest tube or the site where they took out your vein, just ask for the pain medicines because we have protocols already created to give you some pain relief while you're in the hospital. What I'm going to suggest is that don't wait till the very last minute. If a nurse tells you, oh, you got your medicine every 6 hours, well, don't wait to the 7th hour to see if you're going to get better. Just take it as you need it, and you'll see you'll feel much better, and the experience of open heart surgery should be better from a pain perspective. Now, keep in mind that once you're discharged from the hospital, you will continue to take some pain medicines. Now, oftentimes, and what I see commonly is that most patients get off and stop taking their pain medicines about 2 to 3 weeks after the surgery. And at that time, they start transitioning to Tylenol or Motrin. And so usually that's the normal path that I see people taking after surgery to manage their pain and so forth. And those are a few quick tips that I want you to keep in mind when preparing for open heart surgery. So this is Dr. Gonzo. You're watching the Ask Dr. Gonzo Anything channel here on YouTube. Thanks for watching. A lot of the things that I've told you about are down in the description of the video, and so if you want to search them and look them up, please do so. The support groups are also down in the description Again, I participate on them on a daily basis, and there's a lot of really good information, a lot of people that are going or have gone through the same process that you're about to go through. So again, thanks for watching. I'll see you in the next one.